I am going to talk today around the last couple of weeks in your pregnancy and what to do. So we were chatting about this in class there for the past couple of weeks. There are a few girls who are quite heavily pregnant. So I want to just talk about what you should be doing against what the tendency to want to do is. So it's Helen from Nurture Mamas, so say hello. I'm a bit knackered this morning, so excuse the eye bags. So I'm going to just talk through a little bit, answer any questions that come up, or afterwards you can send me a message, and then I'm going to actually show you two poses that you can use pretty easily to help you in the last few weeks of your pregnancy, to help get baby down and to get them into a good birthing position. So one of the main things that we talked about this a few weeks ago, one of the main things you need to think about for your last few weeks of pregnancy is something really simple that a lot of people don't consider, is your posture. And we've spoken about this before, but you always want to try and have your hips higher than your knees when you are in any sort of seated position. So normally when you're in, you're like 37, 38, 39, 41 weeks pregnant, and all you want to do is, slouch back into your chair after a long day or lie back into the couch. And that's actually a really bad position, because if you think about the baby inside you, all you're doing is encouraging. I'm just going to turn on the light here, see if we can a little bit better. Oops, sorry, I got a phone call there, so I was interrupted. So all you're doing is encouraging the baby to get into not such a good position, because they're lying backwards. So what you actually want to do is have baby in a forward lying position, so that their heaviest part of their body, which is their spine, is actually going forward. So hence, if you lie back, you're encouraging them to have their back against your back and get into a back-to-back position, which is not going to give you a great short labour. It'll actually most likely give you quite a long, prolonged labour, which it can be quite a lot more intense because they're in a bad position and they're giving an awful lot of pressure on your lower back. So you want to get those hips higher than your knees, so you're not slouching, and you want to encourage that forward movement. So really thinking about hips higher than your knees and trying to be very slightly forward leaning in your own position when you're sitting. So a really good and a way that forces you to sit into that position is actually on an exercise ball, like a birthing ball. It's like my favorite thing in the world to use, because you can use it to get comfortable during your pregnancy, but also for loads and loads of positions to help you in labour as well. So when you're driving, think about a cushion or some sort of support that'll sit you up so that your hips are up high when you're sitting, just relaxing. At work, if you can sit on an actual exercise ball as well. If anyone laughs, obviously, they don't have to push a baby out of their vagina, so you can that'll probably shut them up quite quickly. So try and get into a good birthing position. And often is the time at the end of your pregnancy is when you are tired. I totally get that. But it's the time when most people stop their exercising. And it's actually the time when you should be exercising quite strongly, as in continuing whatever you've been doing up until that point within reason. So simple, strong walking is brilliant, because it's nice and forward movement, and it's keeping baby in an upright position, so pressing downwards, which is all good. Also, if you know that your baby is lying back to back, I'd encourage you to spend a lot of time in that forward position, so that the hips are nice and high over the knees, and also on the hands and knees position as well. So if you can come down like we practice in yoga, even if you haven't done any yoga before, just getting on all fours, and that will encourage the heaviest part of their baby's body to lie, to come like their spine facing the floor. And there's loads of stuff that you can do in hands and knees position. So that is really important as well. And so even if it's just, try to keep as active as possible, walking up and down even stairs a few times during the day, and just not slouching back into your couch. And then to try and practice some hip opening exercises. So I'm going to talk first and then show you two of those. So a squat and a lunge are fabulous ones to go through. hip opening exercises. So it'll also relieve some of your lower back pain as well. And again, it just opens into the pelvis. So basically what you want to be doing is allowing baby to have the space to naturally move downwards in a downwards direction. So like keeping yourself upright but opening up into the hips, so slightly leaning forward is all a really good position if you can incorporate that into any exercise you do. So say hello there if you're online. I can see there's a few people online. Just give me a little like so I know you're there, or ask questions now or afterwards if you're not watching this live. And yeah, then when you're lying down, actually, when you're going to sleep, what you can try and do is have a cushion under your bump and in between your knees, and then one in your lower back as well. So if you were lying on your side, you'd have a cushion under bump, you'd have a pillow or a cushion, whatever, in between your knees, and then one lying in your back as well, and that'll all help the pelvis well feel nice and supported. And it's very often like people get to kind of 35, 36 weeks and they're like, oh, I feel like a beached whale, I'm hot, I'm uncomfortable. And that's so understandable, and I've been there myself. But if you can try and, I suppose, feel excited and try and just switch the mindset a little bit and think, okay, well, in a few weeks, I'm going to be a mummy or I'm going to be a mother again, which will, you know, try and get yourself, because your labour is all starting in your mind. It's all controlled by your hormones, which will all start in the brain. So it's incredibly important to try and feel positive. If you have any like positive affirmations or like repeat sentences that are that you can repeat, really simple things like I am strong, I can do this, or I'm going to have a wonderful birth, or just things like that that will come naturally to you and you wouldn't feel like a plonker saying them. So if you can try and repeat those and stay in a positive mind set, and then just spoil yourself, because I can tell you, once your baby arrives, you'll either have more children in the house to look after, or going from 0 babies to 1 or twins is probably one of the biggest changes you will ever experience in your life. Phenomenal and just life-altering, wonderful, but also knackering, hard work, you know, so it's extremely tiring. So take this time in the last few weeks of your pregnancy to spoil yourself. Get a beautiful pregnancy massage, treat yourself to a bit of reflexology, just taking time to yourself, go for a walk on your own, meet your friends, and spend time with your partner. That's a huge thing. There's nothing like children to change your relationship, for sure. So, you know, enjoy time together. Just simple things like going out to dinner or just going for a walk or whatever. But try and I suppose what I'm saying is get excited and feel like this is, and it is going to be one of the most happy occasions of your life. So all in the mind, remember. And yeah, so I have a great acronym that I always tell my mothers. Excuse me, take my water. Is RUM. So R for relaxed, U for upright, and M for mobile. So more so in the labour and the birth, but in terms of, it still applies for those last few weeks. So you're trying to still get your baby into a great position. So you're trying to stay relaxed to allow the hormones, because they're working in the first, you know, to prepare the cervix, to prepare your body. So it's really important to try and keep those flowing. So lots of oxytocin, and there's loads that you can do to release oxytocin. Spend time together, you know, get smoochy, and all of that will release oxytocin naturally, which is what will help to actually trigger your labour. So if you are overdue or over your 40-week mark, have sex. So that is one of the proven ways, because the properties in the sperm are very similar to the chemical properties in prostaglandin, which is one of the methods of the gel of an induction in hospital. So that is something that's proven. And then, like all the old wives' tales, you know, go for it. That kind of the nesting and the on your hands and knees and cleaning is actually thought to put people into labour because of the positioning. So it's on the hands and knees, and you're upright still, even if you're not lying backwards. And you know, you can, the thought of all the foods, like the hot spicy foods, the pineapples, and you know, if you ever go on a shopping trolley and have a look in someone's trolley who's overdue, it's quite funny. Really what they are meant to do is actually slightly stimulate and irritate the bowel, and because of the proximity between all the organs, the theory is that's how you can speed up or bring on your labour. So you're more than welcome to try it. So lots of exercise, really good positioning, try and spoil yourself and try and be really calm and happy. And then I just want to show you 2 positions. So I'm going to move this. So apologies, it's going to be a little bit, I'm just going to move you over to the window. Ooh, it's very bright out there. Okay, so hopefully you'll be able to see me. So I'm just going to show you 2 positions to help you get baby into a good birthing position and practice in the last couple of weeks of your labour. So, or of your weeks of your labour. That was a slip of the tongue. Weeks of your pregnancy. So what we're looking at doing is what I was talking about just to show you standing up is when you're sitting down, you want to be thinking about sitting with your hips higher than your knees, which is why sitting on the birthing ball is so good. And you don't want to be allowing this kind of slouch back into the chair and the couch behind you. So a simple one to keep you nice and upright is squats. Okay, so you'd have your legs just slightly pointing away from you, and just a really simple squat. And you're just sitting down like this. You're opening into the pelvis. The knees are going over the toes and then coming back up. You can go wider as well if you want to and sit all the way down and coming up. It'll also be good exercise to get the legs nice and strong, because you want to try and stay upright for as long as possible during your labour to help the gravity. So you're opening into the hips and allowing baby's head to press right down. So you can just come up and down like this a few times if you want to. You could even have a birthing ball, the exercise ball, behind the wall or behind you at the wall and leaning into it. And so it's not as hard work. And then you could try and come down into a full squat on the floor. I just won't really be able to show you that right now, but we've done it in class before. So coming down, if you come to my classes, my in-person pregnancy yoga classes. And then the second one, so that's a squat, and then the second one is the magic lunge. Phenomenal exercise. This is how actually my second child was born. So what you would do is you're getting your hips into a diagonally opening position, and so the knees are wide, your hips are upright on top of your knees, and you're slightly leaning forward, and then you would just basically bend down and you're lunging. So we do this a lot of the time in class on the knee. So your bottom leg is on the knee, on the floor with some cushions to support, and you're basically just coming up and down. This knee goes out over the toe, but you can easily do this standing up as well, or even popping your leg up onto a chair. So you're lunging down, and every time you do that, you're really opening diagonally into the pelvis, which will all allow baby's head to come all the way down. So I'm just going to come back. So I hope those 2 positions were helpful for you, practicing different variations of the squat and practicing different variations of those lunges. So it's like a low lunge, so your bottom knee is on the ground and your foot is out in front of you slightly to the side, and you're just bending down up and down into it. So I'm going to leave it there for this morning. So I'm going to try and come on Facebook Live every Wednesday night, so around kind of 9:15 or so. But I haven't been very good for the past couple of weeks, which is why I've had a couple of morning ones instead. So if you want to ask me questions, just please do give me a like, because once you give more likes and loves, more people will see it, and I really do want to try and help more women. So when you see these Facebook Lives, I'd really appreciate it if you could like them and share them. And what was I going to say? Yeah, if there's any other questions, or if you'd like to see, a specific topic you want to ask me about to discuss, then just send me an email, helen@NurtureMamas.com, or else just comment in underneath one of the Facebook Lives and I'll see them. Any questions and any of the courses that I have online or in person, so the online courses are at NurtureMamas.com, and you can have a look and check out those pre and postnatal classes. And any suggestions at all, just give me a buzz. Have a lovely day and fabulous long weekend. Take care.